Hi everyone, welcome to Current Events Articles in Psychology. I just wanted to express a warm welcome to you for joining me in this adventure. We will be reviewing current articles on various psychological topics to include human sexuality, dating, love, health and wellness, and lots of more articles. Anyway, but the best part is we are going to learn how to interpret each topic using the main perspectives in psychology, such as the behavioral model and the cognitive model, the sociocultural model, and so on and so on. So first, I will review a particular article, then present a lecture on psychology's perspectives. Then you pick one psychological perspective and tell me how that particular perspective interprets the finding of the article. How fun is that? I am so excited to see all of your responses. And you know my motto, go where you are celebrated, not where you are tolerated. Learn lots and smile even more. Oh boy, what an article I have for you today. It's entitled, Ozempic is a wonder drug for weight loss, but this one surprising side effect could ruin your relationship and will make you question if you really want to take it. As we know, my articles are read and is not an opinion that I'm giving you in regards to any mental health issue or physical well-being. This is between you and your doctor. Okay, so this article was written by an anonymous author for Daily Mail. And it goes, I was wiping the kitchen surfaces and humming to myself when I felt a pair of hands on my waist. Normally, I'd have turned to face my husband with a smile, pressing myself against him in a promise of what might come later. But now, puzzlingly, all I felt was irritation. The hands moved higher. I felt rage, rather like PMT, irrational and deep in my stomach. Don't touch me, I said. His face was shocked and hurt. I felt terrible, but at the same time, detached. My husband, Jim, and I always had a passionate, playful, and inventive sex life. I'm talking about from exciting role play to handcuffs and making love at any time of the day. Sex has always been an intrinsic part of our 20-year relationship. However, 8 weeks ago, I started the use of Ozempic injections. All the desire I normally feel for Jim has vanished along with the extra pounds. I'm feeling better about my body than I have in years, but I have no wish whatsoever to have sex. The only emotion I feel when he comes near me is anger and a faint sense of repulsion. Understandably, Jim is very keen that I come off these injections. I'm a nurse at my local general practice in a busy town, and I'm always in a rush. When you work 11-hour days, you tend to eat whenever you can. Patients bring in cupcakes and biscuits the whole time, and it's impossible to resist. I never feel full, and I'm an emotional eater. Whenever I'm happy, sad, grieving, or overwhelmed, my to-go is the biscuit tin, chips, or bottle of wine. I knew that I needed to make long-term changes, but I found it impossible to get started. I tried to stay off from food during the day, and If I managed it, I'd then binge in the evenings. My weight gain usually started during COVID, and by January this year, I'd put on 2 stones. In other words, a lot of pounds. All my clothes were tight and I was uncomfortable with how I looked. I'm in my 40s and I knew that a lot of weight gain carried health risks for the future. We're going on holiday in August and I don't want to feel like the mum people whispered about because I've let myself go. Now, as I have a 15-year-old daughter, I'm extremely cautious about dieting or restricting food, so I never skip meals. We don't have scales in the house. I weigh myself at work, and that's why Ozempic seemed like the good solution. I'd continue to eat with the family, but just have smaller portions. Before using Ozempic, I did plenty of research. I knew the most common side effects. Now, this is according to this particular nurse. I don't want you to feel that it was some huge research study that was done by many researchers, okay? So this particular nurse who wrote this article anonymously said that she did plenty of research. And she goes on to say, I knew the most common side effects, mostly headaches and nausea. And I discussed it with Jim, who said if I felt needed to do it, then he was right behind me. I'd say he's regretting that decision right now. I found an online pharmacy that sold it, which would last 4 weeks. I had to do a lengthy questionnaire. Then they requested a picture of me, which I sent. And then the prescription had to be okayed by a general practitioner, which was done the very next day. Within 24 hours of my first injection, I lost my appetite. It was extraordinary. It was lunchtime at work, and normally I'd be trying to persuade myself to have a salad rather than a mayonnaise-packed sandwich or pastry. But I realized I didn't have any desire to eat. Normally, medications take a bit of time to kick in, but this was less than a day, and it was an exciting feeling. That afternoon, I marveled at how different I felt. By that point, I'd be heading straight for a biscuit tin, but I had no desire to do so. I was thrilled. Clearly, the weight was going to melt away, and I'd feel great about myself in no time. Over that week, I felt more and more satisfied with my decision. I'd wonder whether I might feel less energetic because I'd be eating less. But I upped my water intake and woke up every morning feeling refreshed, ready for the day. It was fabulous. I didn't see Jim much that week. By the way, in case you hadn't noticed, Jim is her husband. So I didn't see Jim much this week. He's a technical engineer and we were on opposite shifts. But then we both had the weekend off and we thought we'd go and do something nice. For us, that was always having sex. That's when he went in for a cuddle in the kitchen, and I realized I just couldn't bear touching him. I wasn't remotely interested. It didn't get better over the subsequent weeks. I don't want to deny him sex. Why should he have to suffer too? But I've been very honest with him and said that I'm not getting anything from it. But when he started kissing me, I've even used the words, just get on with it. I responded physically. I kissed him back and touched him, but I felt nothing. He has tried everything, and I mean everything. He has put in such effort with massages and trying different ways to excite me, but I'm just not interested. I cannot get aroused in any way. Normally, I orgasm easily, But now there's nothing there. Not only has all the pleasure gone from food, I have to force myself to eat. But I don't feel like drinking alcohol either. I've stopped making plans to go out with friends or for dinner with my husband. And what's the point of me and Jim going out together or going away if I don't want to have sex? I feel as though I've lost the pleasures that make life so rich. There's nothing like a delicious, crisp glass of white wine, a creamy curry, or the sheer sweaty pleasure of amazing sex. But I don't enjoy any of those things anymore. I'm thinner, but I'm miserable. It's Hobson's choice. Since this happened, I've Googled Ozempic and lost libido. And I can see others have reported this same side effect. Now, Jim, her husband, is asking, how long am I planning to stay on this drug? I've said for now, I'm going to keep going. I've lost 10 pounds and I've got enough for 4 more weeks. But I can see that more than a month like this might start to damage our marriage, and it's too precious to risk that. So in April, I'll stop with the weekly injections and hope that everything goes back to normal. I'm dying to put on some lovely underwear, feel sexy again with my slimmer figure, and seduce my husband as he deserves. But will this happen? She doesn't know. Are these side effects permanent? Will her libido and sex drive ever return? Will her husband even want or desire to have sex with her if it returns after being rejected for so long? Now, in this article, we go over physical side effects of this commonly used drugs for weight loss. And we really don't know the long-term effect or side effects of these drugs. As we speak, studies are being conducted, but so many celebrities have taken this drug and we see the results. We visually see the results probably after a year of use. But we also see many side effects, many other articles in regards to side effects like stomach problems that you don't hear much about. Okay, so in my upcoming lecture, it's all about abnormal behavior versus normal behavior. And I go over the different psychological perspectives. And I want you to take one perspective and analyze this article using that particular psychological perspective. Let me know what you think. In this lecture, we will review the different perspectives on abnormal behavior. Those in the field of abnormal psychology study people's emotional, cognitive, and/or behavioral problems. Abnormal behavior may be defined as behavior that is disturbing, which is socially unacceptable, distressing, maladaptive, which is self-defeating, and often the result of distorted thoughts, which are cognitions. There are a number of different perspectives used in abnormal psychology. While some psychologists or psychiatrists may focus on a single viewpoint, many mental health professionals use elements from multiple areas in order to better understand and treat psychological disorders. Let us first begin with the medical perspectives. This approach to abnormal psychology focuses on the biological causes of mental illness, emphasizing understanding the underlying cause of disorders, which might include genetic inheritance, related physical illnesses, infections, and chemical imbalances. Medical treatments are often pharmaceutical in nature, although medication is often used in conjunction with some type of psychotherapy. Okay, so those who hold a medical perspective focus on biological and psychological factors as causes of abnormal behavior, which is treated as a disease or mental illness and is diagnosed through symptoms and cured through treatment. Hospitalization and drugs are often preferred methods of treatment rather than psychological investigation. Recent research linking biochemical disorders with some abnormal behaviors has provided some support for this approach. Okay, next, let's move on to the psychodynamic perspective. This perspective has its roots in the theories of Sigmund Freud. The psychoanalytic approach suggests that many abnormal behaviors stem from unconscious thoughts, desires, and memories. While these feelings are outside of awareness, they are still believed to influence conscious actions. Therapists who take this approach believe that by analyzing their memories, behaviors, thoughts, and even dreams, people can uncover and deal with some of the feelings that have been leading to maladaptive behaviors and distress. So again, the psychodynamic perspective proposed as an alternative to the medical approach evolved from Freudian psychoanalytic theory, which contends that psychological disorders are the consequence of anxiety produced by unresolved, unconscious conflicts. Treatment focus on identification and resolution of the conflicts. Now, let's move on to the behavioral perspective. This approach to abnormal psychology focuses on observable behaviors. In behavioral therapy, the focus is on reinforcing positive behaviors and not reinforcing maladaptive behaviors. The behavioral approach targets only the behavior itself, not the underlying causes. When dealing with abnormal behavior, a behavioral therapist might utilize strategies such as classical conditioning and operant conditioning to help eliminate unwanted behaviors and teach new desired behaviors. So, those espousing a behavioral perspective contend that abnormal behavior results from faulty or ineffective learning and conditioning. Treatments are designed to reshape disordered behavior and using traditional learning procedures to treat new, more appropriate, and more adaptive responses. For example, a behavioral analysis of a case of child abuse might suggest that a father abuses his children because he learned the abusive behavior from his father and must now learn more appropriate parenting tactics. Okay, so moving on to the cognitive perspective. The cognitive approach to abnormal psychology focuses on how internal thoughts, perceptions, and reasoning contribute to psychological disorders. Cognitive treatments typically focus on helping the individual change their thoughts or reactions. Cognitive therapy might also be used in conjunction with behavioral methods in a technique known as cognitive behavioral therapy, or CBT. So, according to the cognitive perspective, people engage in abnormal behavior because of particular thoughts and behaviors that are often based upon their false assumptions. Treatments are oriented towards helping the maladjusted individual develop new thought processes and new values. Therapy is a process of unlearning maladaptive habits and replacing them with more useful ones. Okay, and the final perspective of today's lecture is entitled The Social Cultural Perspective. From the social cultural perspective, abnormal behavior is learned within a social context, ranging from the family to the community to the culture. Cultural variables acquired through learning and cognitive processes are believed to be important and produce an abnormal behavior. Anorexia and bulimia, for example, are psychological disorders found mostly in Western cultures, which value the thin female body.